For us, a big thing is connecting with our players from the very beginning. We have the privilege of recruiting extraordinary young women, so that process actually starts several years before they even arrive on campus. Communication is one of the hallmarks for our program, so we spend a lot of time talking with our players about just general things. It's really hard to come and spill your spill your guts to someone that you're not even comfortable talking about. How do I catch a ground ball or how do I hit? So we do a lot of one-on-one meetings, especially in the fall, with our players. We make sure all those small touch points, trust is built, kind of, Brene Brown says, one marble in the jar at a time. So we try to have a lot of those little marble moments where, how's your day going? And when it's been a day, okay, well, tell me about your day. And not minding taking that time to, okay, we may take a few less reps today at practice, but let's talk through those things. We do a lot of things with group conversations, getting to know you conversations as a team, but it's not any one thing, but it's one of about probably 50 things that we do over the course of a day and just throughout our program. I think if we would treat it as truly health and seeking to create wellness, I think sometimes if I break my foot, I'm going to go to an orthopedic surgeon, they're going to pin it, and the goal is to restore me back to good health. I think sometimes people say, well, I'm always going to struggle with depression, or I'm always going to struggle with anxiety, or I'm always going to, and there are definitely some medical things where you might always, but it doesn't always have to be the dark pit bad days. I think we've got to take mental health to where we're not just, it stinks to be where you are. It's like, okay, it stinks to be where you are, but how can we not stay where we are? How do we move to better health? And I think that's going to get people to ask for more help. I don't have to stay this way. I don't have to feel this way for the rest of my life. That's discouraging, because just about everything else in health, there's a way to even alleviate symptoms, something, get us in a better spot and pursue better health. And I think that's the part of, sometimes it's like, if I have a struggle with mental health, I'm never going to get better. And that's not the case, but it sometimes is perceived that way. So if there's clear paths to good health, I think it's going to be a better place for our athletes to grow and learn and maintain health. You've got to find out who you are when you don't play a sport long before you retire. Because if you're going to play at the level that you're actually capable of, you got to find out who you are when you don't have a ball in your hand. And that's one of the hard things for athletes to do as they're coming through. But the ones that do play at the highest levels, because they realize my value as a person isn't tied to what I can do on the field. And that is a magical moment for athletes, because they suddenly tap into unused potential. Because if my value's tied to, especially in our game, a game of failure, then I'll hedge my bets. I won't let all of me go, because I've got to protect something. But if my value as a person isn't tied to that, then I can play at levels that I never even knew possible. So the language we use when we talk to them, they are not players in our program. They are souls precious in the sight of God, and they're treated as such. And I think that's a big point for coaches. You have to treat them as people, as grown women or grown men, and realize that they are valuable far beyond anything they do on the field.